Morning Crossfire on 99.3 Nigeria Info.
Brilliant morning to you, Lagos, Nigeria. You're most welcome. If you're just joining us for the very first time, yes, of course, you're most welcome. I am Sheriff Quadry, and nice to meet you. It's Health Thursday, by the way, because it's Thursday, right? And we will be talking about eye care. It's no news that people rarely even care about their eyes. We do all sort of things to our eyes without even batting an eyelid. You know, what a coincidence. But that's the way we treat our eyes, right? Don't we? So we're going to be talking extensively about that this morning. So you're most welcome to watch us live on Facebook and on YouTube. My guest is already seated here in the studio. And if you've got questions for my guest, you're most welcome to throw them in. The WhatsApp number is 0809 597 5805 on WhatsApp. That is 0809 597 5805 on WhatsApp. Let's have your questions early enough so that we can get to them very quickly. Findings from the Nigerian National Blindness and Visual Impairment Survey have revealed about 4.2% of Nigerians over 40 years old are blind, while an estimated 4.25 million adults aged between 40 and above suffer from moderate to severe visual impairment. According to the national survey, roughly 4 in every 100 adults sampled had serious vision loss, and about 84% of blindness in Nigeria is avoidable. So tell me why this conversation is not very important. Most of these cases can be prevented or treated with cataract surgery or a pair of glasses, early detection, or basic public health measures. These are the things that can be done to have prevented these staggering data that I just released to you. In 2019, the federal government launched 3 policy documents to improve vision and eye health in Nigeria. According to the Minister of State for Health and Social Welfare, Dr. Tunji Alausa, the policy document, namely the National Eye Health Strategic Plan, the Nigeria Glaucoma Guidelines and Toolkit, and the National Guidelines for Screening and Management of Diabetic Retinopathy, were part of government strategic guidelines to improve eye health in the country. Now, listen, Lagos, come with me. Why are many Nigerians still losing their sight today, this day and age, when it's actually preventable? Is it about education? Is it about awareness? Is it about personal hygiene? What is it about? Has anyone, if you're listening to me right now, if you're on this channel right now, have you had surgery done to improve cataract or bought reading glasses, or you've bought reading glasses lately? I have lately. Now, when last did you check your eyes? Try, ruminate, ponder over these questions, then I will come back to you to get your reaction. In the meantime, I have to bring on my guest right now because she's here this morning to have this all-important conversation with us. Dr. Chidinma Onyejekwe is here. Dr. Chidinma, by the way, she is a consultant ophthalmologist at the Lagos State University Teaching Hospital, Ikeja, Lagos. Chidinma, thank you so much for joining us this morning.
Good morning. It's a pleasure.
It's good to have you here.
Thank you so much.
Let's start with what is responsible for the numbers I just read out. What's responsible for it?
Okay, so you rightly read out that about 4.2% are blind, and like you said, 84% of the blindness is avoidable, meaning that it could either be treatable or preventable.
Right.
So largely the main cause of blindness in Nigeria is cataract. Okay. Accounting for about 43% of blindness. After that, we have glaucoma, accounting for about 16.7% of blindness.
Yeah.
After that, we have what we call corneal scars. So the cornea is the black part, you know, when you look at the eye, that black central part that you're looking at. So when there is anything that affects it, infections, inflammations, it can scar. So we say it is black, but it's actually transparent to allow vision, to allow light rays to enter. So if anything affects it, it scars, it becomes white, and it can cause blindness. And some of the common things that cause corneal scarring here in this part of the world, preventable diseases like you said, which include trachoma, measles, and also what we call harmful eye medications. We put a lot of harmful substances in this part of the world in our eye.
Yeah.
Urine, different type of things.
People put urine in their eyes?
Yes, people put urine in their eyes. People put salt water, sea water, onions.
Do you know what they're looking for? I'm wondering, like something they're searching for. Like
when they have like redness of the eye, maybe what people call Apollo. And then their neighbor says, oh, please put urine, put this, put seawater, put holy water. Okay, so that's like the third cause of blindness. Then we have other causes like diabetic retinopathy, which is basically just diabetes affecting the eye. We have other causes like for what we call visual impairments. Now, this is not frank blindness.
Okay.
There's still some vision, but it's not optimal. Okay, but the person is not yet blind.
Okay.
So this is where we have what we call the uncorrected refractive errors, accounting for a majority cause of visual impairments. And just like you said, refractive errors are basically eye conditions that need glasses, just glasses to be corrected. So we have a lot of people that still do not use glasses for reasons that we do not know, and that is accounting for a majority of severe visual impairment in this country.
Let's talk about children. Let's talk about eye care in children. Most parents don't pay attention to this.
Yes.
I remember when I was pretty young, I didn't even know I had eye problems. I just knew that majority of my schoolwork, I was doing it with brain because I wasn't seeing the board.
Yeah.
And back then it was blackboard and chalk, and the class you see 50, 100 children in one class is like a hall.
Yeah.
And I will be seated somewhere, I don't know, because I couldn't even get a seat in front. So it was pretty difficult. I developed my own coping mechanism. So I just capitalized on listening to the teacher. So whatever he or she was saying, I was recording it in my brain because I couldn't even see what was going on.
Yeah.
How can parents pay more attention to this? What are the things that they need to watch out for?
Okay, thank you. So I would say that sometimes parents actually know that something is wrong, but they just neglect it for some reasons. One of them is it's too early, or a child is too young to use glasses. But I would also say that you should watch your child, at home. The children still come back home with assignments. If a child is not, children don't know how to hide symptoms. If a child is not seeing properly, you would know. Sometimes the child is mixing up letters while trying to write. Sometimes the child is squinting. Those are some signs of a child that needs glasses. Sometimes the child needs to go close. The child is going very close to the book, going very close to the television just to see.
Yeah.
So those are pointers. But for some reasons, parents neglect those pointers. They ignore them with the guise that a child is too young to have eye problem. But an eye disorder can happen at any age. It can happen from birth. It can happen during infancy, during preschool, during toddler. How
do you know a toddler has eye problems? I've seen videos of toddlers, people giving toddlers glasses and the baby, and they start singing and everybody's happy and they're all emotional. How do you know? Yeah, so there are some pointers. There's for toddlers, there's some certain developments that they should have at that time. A toddler should be able to move around. If he's still under 1 year, he should be able to crawl around. If he's more than one, a toddler should move around. So if a child is moving around and hitting objects, bumping into objects, an infant is not reaching out for objects, that's a pointer that there's something wrong with his vision. Okay. Another pointer is if the child prefers to use one eye, he's going close to something and he prefers to use one eye to look at it. That means there's something wrong with the other eye, or maybe something wrong with the two eyes, just that the other one is severe. Okay. Other pointers include a child that has what we call a white reflex.
you look into a child's eye and you see something white coming back to you, maybe that child has cataract.
Okay.
Or a child is having redness of the eyes, cannot open the eye to to light. That's also another pointer that this child's vision is impaired. So when there is impaired vision in children, it will impair their development. Okay, the child doesn't look at the mother. Maybe a newborn baby, the mother is breastfeeding. He's not focusing at that age as a baby. The child focuses on the mother's face. The child is not focusing. Mothers have instincts, so they always know. Most times they just choose to ignore.
I want to stay on children before we move on to the Agbalagbas.
Yeah.
And this thing is very delicate in a way. I hear people say that I don't want my child to use glasses. Like you said, it's too young to self-correct. When a child is given medicated glasses, does it correct at some point? Or that's how the child grows up? The child sticks to those glasses. Are there some time when, the sight corrects itself with the aid of the
glasses? Okay, so most times, the glasses, like I always tell people, they only work when they are on the eye. There's no drug in it that will diffuse into the eye. So what the glasses are doing, they're just a pair of lenses that work by bending light rays, either converging the light rays or diverging the light rays, depending on what condition the person has. So for children that get glasses, almost all of them would tend to use their glasses for the rest of their lives. Why? Because their eyeball, as children are born, they are born with a certain length of their eyeball, but as we grow, the eyeball grows longer. Now, sometimes the eyeball may grow longer than normal, or it will be shorter than normal for the age. So what the glasses are doing is to, if the eye is longer than normal, it will help to focus the light rays. If it's shorter than normal, it will still help to focus the light rays. Now, for some children, the eyeballs will grow to, get to a particular size where there's like some correction. You don't really need to use the lenses at that stage again. So those ones may, after some time, not use glasses.
Any particular age for those ones?
The age at which the eye gets to its normal size is 7 years. Okay, it could go over 7 years, but this group they are really, really very few. Okay, most children that start using glasses would eventually need to use it for the rest of their lives, because it's probably that the eyeball was smaller than normal or longer than normal. And when a child is on glasses, you need to check every 6 months, because just like I said, the eye is growing. So the power of the glasses that the child needs also changes. So every 6 months, the child should go to check those glasses again to know if the dynamics have changed, so that they can change it. Or else, the pair of glasses you got last year for a child may not work again this year, and the child begins to have vision blur again and begins to complain, may have headaches. Like you said, that child will also do poorly in class. So a lot of academic performance, poor academic performance, has actually been linked to poor vision in children. Okay, and people just say, oh, this child does not know anything. This child, meanwhile, the child is not seeing well. And just like you said, you developed your own coping mechanisms by listening. Some children don't even bother, they just zone out. Okay, they don't write, they don't copy from the board, they can't do assignments, they can't learn, and the child just grows like that. Meanwhile, that child needed glasses at that point.
Dr. Chidinma Onyejekwe is here, and I want to, one last question on children, because I know adults are waiting for us, is that, are there some type of eye defects apart from the lens thing, cataract, glaucoma, that children can have, and how do you know if they have what do you people call it, high eye pressure or something like that?
Okay, high pressure.
Yeah.
Okay, so children can have cataracts, like I said. They can have some children.
They can have all of these things that adults have.
Yes.
Oh.
Children can have cataracts. Some children are born with cataracts. They are called congenital cataracts. So cataract is something that you see. Once you look into the eye, there's a white reflex coming back to you. And it's important for us not to ignore or neglect it. a lot of people say things like, this baby is too young to have surgery. No. Ideally, a child born with cataract should have the surgery done by 6 weeks of age. Even if he can't do it at that 6 weeks of age, he can do it at any time. 3 months, 4 months, 5 months, 1 year. So there is no but to have cataract surgery. The most important thing is to get the child to the hospital. It is assessed and the time for surgery is given. Then children could also have glaucoma. Okay, glaucoma is the one that is a condition whereby the pressures in the eye are very high. And then those pressures press on the nerve of the eye, which is the final path of vision. Okay, so children can also have glaucoma. In children, pointers to glaucoma includes an eyeball that is bigger than normal. Okay, so you see an eyeball that is enlarging. It may be the 2 eyes or it may just be 1 eye. And it's important for parents to note that it's not, some people will say things like, that's how it is in our family. We have big eyes in our family. You know. Once an eye is enlarging more than normal, it may be a pointer to glaucoma. Another pointer to glaucoma is when the child cannot open the eyes to light. The child is always, the eye is always watering. When the child goes near light, it's very uncomfortable. That's another pointer to glaucoma. Children can also have what we call retinoblastoma. This is an eye cancer. Okay, it occurs in children. It can happen in the first year of life. It can happen after the first year of life till like about 6-7 years. It's also noticed as a white reflex. You look into the eye. People call it a white speck, whatever. We call it a white reflex. You look into the eye and there's something white coming back to you. That's a pointer of retinoblastoma. Now, children can also have what we call retinopathy of prematurity. And it's important that I point out because this is maturity. So babies that are born too soon can also have an eye condition that can cause blindness. And because of increasing technology, advancing technology in taking care of premature babies, we have a lot of our preterm babies living, unlike before, where preterm babies, maybe after some time, they die. But we have a lot of preterm babies surviving. So it is important to note that there is an eye condition in them that is as a result of prematurity that can lead to blindness. So a preterm baby must be assessed by an ophthalmologist within 4 weeks of birth and also have further assessments, because if that condition happens, there are treatments that must be given or else the child will go blind. Other things like infectious causes, measles, vitamin A deficiency, these things are largely controlled or covered by immunization. So our immunization schedule also helps in preventing some of these infective eye diseases like measles. Ensure that the child is immunized. You know, there's a lot of story about immunization now, but we won't get into it. But it's important that the child is immunized, you know, as at when due against measles. Other things in children that we're seeing now is trauma, injury. Okay, so eye trauma is also causing a lot of vision impairments and blindness in children. Trauma from pencil, biros, sharp objects, maybe the teacher flogging at school, children playing around, scissors, bottle, maybe they're in their mom's shop and their mom sells bottle drinks, and one of the bottle explodes and it enters into the eye. So it's also important for us to know that we need to protect our children around sharp objects. You know, mothers should be watchful, parents should be watchful. Teachers should also be educated on the use of cane. Okay, they should flog the children from the waist down. They have to flog.
That's been abolished in Lagos, by the way. So
okay. They don't do that. So if anybody wants to flog their child from the waist down, avoid the waist up, because we've seen a lot of children go blind from cane. Teach children how to use pencils. They should use it only when they want to, when they are ready to use it. When they are not using it, they should take the pencils away. They shouldn't hold sharp objects, glasses carelessly. So eye trauma is also another thing that can cause blindness. Then, like I said, harmful medications, and people do it a lot in children. A child has a red eye, you put urine in the child's eye, you put breast milk, you put seawater, salt water, onions, different things, engine oil, toothpaste. You know, and I don't know where people are getting this knowledge from. I don't know if they have seen anybody that used these substances and their eyes got better. But the eye is a sterile environment. You know, it has a particular what we call pH. It has its own environment. So anything you're introducing in the eye drops that we use in the eye, they have been tested, they have been checked that they are not harmful, they are not toxic. So any of all these things, once they get into the eye, they are toxic to the eye. Some of them damage the eye in instants, in seconds to minutes. So that's another major cause of vision impairments and blindness in children.
We're going to head out for a quick break. Lagos, you're most welcome if you're just tuning in. We're talking eye care with Dr. Chidinma, and I can see your questions are already coming through. When we return, we'll take a few questions before we move on to adult eye care. Stay here with us. We'll be back in a moment.
99.3 Nigeria Info. We'll be right back. Update. Here's the gist. New Good Mama detergent delivers express cleaning and fragrance boosters for extra freshness. All in a freshening pack made for your upgrade. Try it today.
Good Mama, the washing is fast. Good Mama, my fabric is barely fresh. Good Mama, express cleaning. Good Mama, my laundry isn't too smile.
There's a reason she's a good mama. Express cleaning, extra fresh.
Mommy, what is 3 plus 1 plus 1?
5.
So what's 4 plus 1?
That's 5 school days of nourishing Ovaltine multi-chocolate goodness.
Yummy!
Buy the special Ovaltine pack with 4 sachets and 1 free for every school day. That's not all. Ovaltine is enriched with calcium, vitamin B12 and malt to support learning and playtime. Ovaltine, smart choice for smart kids.
How do we make our cooking come alive? Oh, for that tasty meal where you like, oh. I mean, you want cook food to impress, oh.
Whether it's jollof or na stew, even for porridge or spaghetti, cook to impress with Pepper Terra.
Okay, now. Dependable insurance. After God, you are the next insurance. See as the boys, the Allah. All the ladies, the Allah. Ensure your car protection from accidents. Unforeseen loss, you can see them. Mistakes are meant to happen. If you don't jam the car, they'll jam yours. Will you beat them? Yes, you will get them arrested. Your plans for that day is affected. You waste your money, you waste energy. That's how you can be protected.
Get the protection that pays today. Call 0700 AXA Mansa to get a motor insurance that pays. AXA, know you can.
Babe, how you go describe something way big past big?
Na grand, like mountain, like jumbo, like better soup way sweet.
You forget one thing, oh, Black Friday discount.
Where it they happen?
Now for Grand Square.
Talk true.
From November 27th to 29th, 2025, Grand Square, they give up to 70% off on selected goods, massive savings on supermarket essentials, electronics, furniture, beverages, wines and spirits, and much more. Better discount, we go sweet your belly.
Oh boy, na real grand Black Friday bonanza be this, oh.
No dolly yourself. Offer day valid while stock last. Make you no carry last, oh. Go Grand Square Ikeja, Grand Square Victoria Island, Grand Square Abuja, and Grand Square Kano to enjoy this better woof.
Black Friday at Grand Square, November 27th to 29th. Grand savings way past grand.
Whether you're flying for a family celebration or a much-needed reunion, fly Emirates and start your holiday on board. Explore up to 6,500 channels of entertainment, including live sport. Stay connected with onboard Wi-Fi. Enjoy special meals and toys for kids and relax in comfort with world-class service all the way. Choose from over 150 destinations, including Dubai, India, the UK and USA. Book now at Emirates.com. Fly Emirates. Fly better.
Mom, let's celebrate Christmas at its peak. I want Christmas lights so bright they could see it in space. Wow! I want a Christmas tree so tall players would have to watch out.
Think bigger.
Like what?
Pancakes stacked to the ceiling, delicious eggs, and a peak milk smoothie.
Just for me? Now that's Christmas at its peak.
Because truly, a peak Christmas is Christmas with Peak. Peak. Reach for your peak.
I am the chef of life with Mr. Flavor. Niger vibe, Mr. Chef, two finger crush. I am the chef of
Taste your chef. Taste home. Taste culture.
Chef of life.
Whether you're buying smoky jollof from your favorite spot in Ikeja, shopping online for your latest styles, or booking your next getaway to Dubai, MasterCard gives you the freedom to pay your way. Insert, tap, swipe, or click. So many options, yet so easy. With layers of security protecting every payment, your money stays safe.
From Danfo to travel, MasterCard connects you to the life you've earned and the one you dream of. Ask your bank for a MasterCard today. MasterCard, safe, convenient, priceless.
This Black Friday, Lagos, get ready! Cinemat Superstore is bringing you unbeatable deals from November 28th to December 7th. Get discounts on Samsung, TCL, My Dear, Gree, Royal Appliances, TVs, washing machines, air conditioners, refrigerators, and more.
And that's not all. All shoppers are automatically included in our Black Friday raffle draw. Don't miss it. Rush to Cinemat Superstore, the Palm Shopping Mall, Lekki.
It's the Indomie Eat and Win promo. The more you eat, the more you win. How to win? Buy the Indomie Eat and Win promo pack. Find the promo code inside. Visit indomie.ng/eat and win. Enter your promo code and start earning points fast. For a chance to win exciting gifts and 1 million naira cash every week for a lucky winner. So hurry now, eat and win. Let the winning begin. Visit indomie.ng/eat and win for more details. Terms and conditions apply.
Turn your savings into real gains in the Union Bank Save and Gain campaign. Save 50,000 naira or more in your Union Bank account. Perform 5 transactions on our digital channels to qualify for monthly cash rewards of up to 5 million naira. No raffles, no delays, just gains every time you save with Union Bank. Campaign runs until April 2026 and is open to new and existing customers. Terms and conditions apply. Union Bank, your simpler, smarter bank.
This taste na banger, this taste na creamy rich, this taste na new Nescafe, original 3-in-1. Thickness, enjoyment, yumminess, happiness, delightfulness, deliciousness, smoothness. This taste na new Nescafe, original 3-in-1.
Enjoy more creamy richness with the new Nescafe original 3-in-1 in the new pack. That's strong, finish strong.
Babe, how you go describe something way big past big?
Na grand, like mountain, like jumbo, like better soup way sweet.
You forget one thing, oh, Black Friday discount.
Where it they happen?
Now for Grand Square.
Talk true.
From November 27th to 29th, 2025, Grand Square, they give up to 70% off on selected goods, massive savings on supermarket essentials, electronics, furniture, beverages, wines and spirits, and much more. Better discount, we go sweet your belly.
Oh boy, na real grand Black Friday bonanza be this oh.
No dolly yourself. Offer day valid while stock last. Make you no carry last oh. Go Grand Square Ikeja, Grand Square Victoria Island, Grand Square Abuja, and Grand Square Kano to enjoy this better wolf.
Black Friday at Grand Square, November 27 to 29th. Grand savings way past grand.
This is the sound of someone who doesn't have to worry about lifing. It is the sound of a person who knows Leadway Health HMO covers him. No panic, no fear, just premium peace of mind. Leadway Health HMO's coverage is so good, you too can experience peace. Life happens, but with Leadway Health HMO, peace of mind is always within reach. For 3 years running, we've been recognized as Nigeria's best HMO because when it comes to your health, we've truly got you covered. Leadway Health, and more.
Africa is all connected. With Turkish Airlines FlyFest, fly to Europe, to America, and to Istanbul at special prices. Book your ticket until December 15th for flights between September 15th and December 15th. For details, please visit TurkishAirlines.com. Turkish Airlines.
Welcome
Welcome to Nigeria Info, where the news sparks conversation.
The Mieti Ala Cattle Breeders Association has condemned the sanctions against them.
We're like a sour soup waiting for someone to warm up. To wake up to the House of Assembly. You have to wake up to the House of Assembly.
All this talk about voodoo is nonsense. If I had any authority, I'll fire
The
him.
football team is as bad as the economy of the country.
If you listen to both ends of the argument, whether it's the one where there is a genocide or the one where there's no genocide.
So ever since they have been saying they have been defeating and killing and the rest of them, it's like what they are just interested in now is who is coming to their party, who is not coming to their party.
So what people call this one now, Chibok 3.0?
This is your space to listen, share, and be heard. 99.3 Nigeria Info. Let's talk.
This is Morning Crossfire on 99.3 Nigeria Info.
Morning, Lagos. Thank you again for staying there. It's 8:35 from our studios, and we are so glad that you're with us. I can see your questions. We'll start with the questions on social media, Twitter, that is X, Facebook, and on WhatsApp. X is at Nigeria Info FM. Facebook is Nigeria Info 99.3. YouTube is Nigeria Info FM. We're streaming on Facebook and on YouTube, so you can drop your questions there. I've just seen a question of someone who says they have worm-like stuff coming out of their eyes. We'll get to that in a moment. WhatsApp is 0809 597 5805 on WhatsApp. You can drop your questions there as well. I have Dr. Chidinma Onyejekwe here. She's a consultant ophthalmologist here in Lagos, and we've been talking about eye care. We'll move to adult eye care in a moment, but let's take your questions. 0201 2770 993. That is 0201 2770 993. Female only line. Only females can call this number. Again, I always say this: don't stress us. Don't stress us. If you're not sure about your gender, ask somebody. Let somebody confirm, please. Don't stress us. Don't call the female line and be saying, "Hello, Sherry." You know. So the female only line now. I want to call the female only line. Please don't call it if you're a man. 0201 465 7190. That's for female callers only. 0201 465 7190. Let's take our first call on the show today. Good morning to you. Good morning. Are you here?
Okay. My question goes like this. If Rasta is coming out from your children's eye in the morning, is there anything that need to be worried about?
Do you understand that?
If what?
If what? If what is coming out?
Rasta.
That thing. That's
okay.
Yes.
So you mean like discharge? Well.
Yes.
Most times when we wake up, because our eyes have been closed, when we wake up in the morning and we open our eyes, we may have a little discharge or just collection at the corner of the eye. But however, if you notice that it is consistent, especially as you're saying that it's in children, if you notice that you see it every day, and then it is quite large, it's quite an amount. What you're supposed to have there is just very small, something that you remove with your fingers and you can barely see it. But if you have it in a large amount, and if you have it happening almost every day, and the child is having redness or itching, please take the child to the hospital to see an eye specialist. Thank you.
Okay. We have this call coming in from the UK. Let's see who is here. Good morning to you.
Or just
Good morning.
collection.
Good morning.
Yes, please.
Okay. My name is Aderonke and I'm calling you from England. I just want to quickly say, I know I have a minute, I'll quickly round. I have an 18-year-old daughter who, when she was born, had a problem with the eyes. I just want to say thank you to the doctors for all the things they do. I did not know that she had a problem with her eyes, but when it was my boss then who said, this girl had something wrong with her eyes. I did not believe her. After I resumed maternity leave, she kept telling me, have you taken her to the doctor? I still did not believe her until I told the father. The father now said, oh, what is wrong with her eyes is what the last born of their family has. Really? So something is wrong with her eyes? I did not know. I took her to the ophthalmologist, and then the ophthalmologist checked her and was like, if I noticed, I would notice that my daughter was not seeing me. I say, hey, my daughter wasn't seeing me at 6 months. And I was like, God have mercy. Then she now said that I should help her focus. That what she could see is that she moves, she is trying to focus, but she doesn't know what to see. So she would depend on one eye and then shift from one eye to another eye. And that she said that was a good sign because it shows that one eye is not dead. If not, there are times that the patient would rely on one eye solely, and then the ignored eye would die off. So she said that she had a squint. The right eye was looking to the left, inwards to the left, upwards. The left eye was looking inward to the right. And then she said that it was either surgery or glasses. At 6 months, okay. Surgery, no. So she said that we should come when she was a year old and then she would get glasses. So she got the glasses. How they were able to know her prescription, only God knows. But they kept looking into her eyes, and for a baby, for a year-old who was not staying in one place, an adult will say, yes, I see well with this, I don't see well with these lenses. I give kudos to them. So eventually she got the glasses. Every 6 months we kept taking her back. And then now when she was 10 years old, I took her back to the ophthalmologist who checked her eyes and said the squint had gone, but she now has astigmatism, and then she's going to be 19 in February, but she's still wearing her glasses as the doctor said. She would be wearing her glasses for the rest of her lives. So she said the optometrist now said that she's long-sighted, but it mimics short-sightedness. I know she would know the funny name for it, but I thank God for them, for the work they do and all of that. God bless you, doctors.
Thank
you. Bye. Thank you so much for calling. Appreciate it. Again, this underscores what we spent the first 30 minutes talking about, how parents need to pay more attention, especially to babies. But then she mentioned something. How do you know the measurement of a baby's lens?
Okay, so we use more objective assessments.
Okay.
We have some instruments that we use. There's a lot of physics and optics to it, but when we use those instruments, we direct them into the eye, and then we put lenses. We keep on changing the lenses. There's a particular reflex that will get back from the eye to know that this is the appropriate measurement for this eye. So that is how we do for children. For babies, of course, on infants that cannot yet talk or give you responses. Yes.
All right. Let's take another call. Good morning.
Good morning.
Yes, please.
Am I speaking with Nigeria Info?
Yes, you're on Nigeria Info.
Okay. Thank you very much.
Yes,
My
ma'am.
name is Mrs. Abitu.
You're welcome, ma'am.
I want to ask about this cataract of a thing.
Okay.
It happens to someone that is close to me. My daughter's mother-in-law. Good cataract. I don't know why. I started with red something. It was red before that cataract cut. So I don't know what happens that makes it to come at that age. And I advise the children that I'm not sure that she will be operated to go and operate the cataract.
Okay.
So I don't know whether I'm on.
You are in order. Nice. Okay. All right. Let's ask the doctor, ma'am. Doctor.
Okay, so you actually can at age.
Okay.
What if is to remove patients from visual disability? So if ma is not done, and if she's still very healthy, we have some elderly people that still read, they probably watch TV, read their Bibles, read the other religious books, and do other things. She should have a cataract.
So that quality of life is very important.
It's very important. So if it's significantly impairing her quality of life, she should have a surgery done. She's not too old to have a cataract removed. If she goes to the doctor will assess her if she's fit for surgery. We don't just take everybody to the operating room.
Yeah.
If we assess that she's physically fit for surgery, why not? She would have the surgery done. And I also want to say that the commonest form of cataract is the age-related cataract, meaning that it happens as a result of aging.
Okay.
So the cataract is an opacity of what we call the lens in the eye. But with age, the mechanisms that keep that lens clear, they tend to begin to get weak. So we have some proteins there beginning to get opaque, absorb water. So with increasing age, the risk of cataract is higher. So she shouldn't be surprised that it's happening in an 80-year-old woman. Thank you.
We're going to take this call. Good morning to you. Good morning.
Good morning.
Yes, please.
I have a glaucoma patient.
Okay.
And can you hear me?
Yeah, we can hear.
I've had surgery on both eyes, and I was told, in fact, I was told that the surgery.
Do you have a question quickly? Do you have a question quickly?
I meant the pressure. Surgery.
Okay.
The surgery over the pressure is maintained because I glaucoma whatever. Like the vision very low. In fact, I've lost one complete. The other one remaining there is less than 5 inches. The better I'm applying the medication as cataract both eyes too. My is very low. I'm losing by the day. So what could have been? I've gone to hospitals.
All right. Let the doctor respond. Thank you.
Okay, sir. So the one thing you know about glaucoma is damage it causes is irreversible. Okay, so whatever state glaucoma that we meet you have cannot be reversed. The that we give at that point is to prevent further damage. So I don't know what is in his eye. I would need to examine to make correct statements.
Is it true that what he said is his eye, so he knows? So he said he's losing eyes by the day.
By the day.
Is that? If he's on medication, why is
he losing his eye? Well, I wouldn't know what his vision was at the time the surgery was done. Okay. Sometimes, some people expect that with surgery, there should still be some improvements in vision, but it doesn't happen with glaucoma. And then the vision loss in glaucoma, the aim of drugs and treatment is to prevent it. Sometimes in some patients have a very fulminant form of glaucoma, there may still be some damage ongoing. Now, he also needs to be sure that there's nothing else happening in the eye. There are other things that could happen in the eye. Other things are associated with aging, diabetes, hypertension, what we call a macular degeneration. So I would advise that he gets his eye properly checked.
That's the word I was looking for. Macular degeneration.
Okay, macular degeneration, yes. Advice. And then people that already have advanced glaucoma, they have this vision that some days it's like they are seeing very well, and some other days it's like the vision is poor. So there's this fluctuation, there's this vision fluctuation that very advanced glaucoma gives. And patients could say, I feel like some of them see better in the mornings, some of them see better at night. Glaucoma is just one disease that is quite bad.
Let's take this message on YouTube. We're streaming on YouTube. By the way, Nigeria Info 99.3. Eniobong says, I want to know, my eyes are good, but I am always putting my hands in my eyes because there is something like worm coming out of my eyes. Please, what should I do to stop it?
Okay, so the two statements themselves are good. They say worm. You just need to get your eye checked. Don't ignore any symptom. Something like worm coming, move eyes could be anything. It could be that there's an inflammation. It could be that there's an infection. It could be that you're having some allergies, and you may actually have a worm in the eye because we have an infectious disease that appears like a worm in the eye and moves around in the eye. Occurs more in some regions. It's called onchocerciasis. It occurs more in some regions, but sometimes we have it in the urban areas, and all that. So he should have his eyes checked, please.
I have another one here from Jaffano, I think. And the person says, thank you for... Okay, let's just go straight. It says, my question is, what is the cause of preceptocellulitis in a child? And they said, I need help, ma.
Okay, so preceptal cellulitis is just infection of the structures of the eye. Okay, so this is the whole eye. We have the skin, we have the eyeball. So the structures of the eye that are anterior to the eyeball itself. Okay, and the skin is there, what we call the subcutaneous tissue. The main cause in children is respiratory infections. So the respiratory, the nose, the throat, sinuses, Okay, especially the upper children generally have a lot of upper respiratory infections, viruses. So a child that's recently coughed, a catarrh, or what we call throat or tonsillitis or jaws is at risk of having a cellulitis. Other things include boils on the lid, on the eye. A child that has maybe an abscess or a dental carie, maybe a toothache, or a child that has recently had a dental procedure. All those things can cause preceptal cellulitis, but the commonest is an upper respiratory infection. And please, if the child has the preceptal cellulitis, it should be attended to as soon as possible, because it can move from the anterior part of the eye into the eyeball. It can move from the eyeball into the brain. The preceptal cellulitis, even though it may look mild initially, it can cause more, damaging conditions. Thank you.
Wow.
Yeah.
So I have another question. So let me just put this out there, right? Please go and see a doctor. Go and see a doctor. Don't wait till we bring a doctor on the show. If you have problems with your eyes, go and see a doctor. Like, for now, I can't take 5% of the messages that we have here. Go and see a doctor. I have Recpine. I don't know what this Recpine is. And they said, can I be treated? What's Recpine? REKPEN. PENE. I don't know what that is.
I also do not know what that
okay,
is.
so maybe it's autocorrect. Please, you can resend it again if you're able to take it. That's good. My younger brother is having cataract at one eye. He's using only one eye now. After the surgery, can he see with the second eye?
Yes. So cataract vision impairment is reversible as against glaucoma. When the cataract surgery is done, with appropriate technology, of course, done well. To see immediately after surgery.
Doc is please share your social media handles so people can come ask, because we can't get to all of them. No, we can't.
Okay. On Instagram, you see me at Chidinma Kedi. DINMA KEDI.
Chidinma is from Chidinma. Do you understand? Chidinma Kedi.
Yes.
Okay, that's on Instagram.
That's on Instagram.
And they can reach you there.
Yes, they can reach me there. I'm not so active on the other.
On the other ones.
Yes.
It's just Instagram. Dr. Chidinma Onyejekwe, thank you so much for joining us today on Health Thursday.
Thank you.
Dr. Chidinma is a consultant ophthalmologist, Lagos State University Teaching Hospital, Ikeja, Lagos. She handles a broad range of eye care services, from regular vision care and eye health to surgical interventions and post-operative rehabilitation as well. Specialists include adult ophthalmology, pediatric ophthalmology, cataract, vision correction surgery, including LASIK and vision correction, vitreous or retina surgery, and visual rehabilitation. Chidinma, thank you.
Thank you so much.
Lagos, that's our show today. Thank you for being a part of it. You can rewatch this show again on Facebook and on YouTube, Nigeria Info 99.3. Many thanks to the producer of the show, Zainab Yakin. We're back tomorrow with Open Mic Friday. Stick around. Jimmy Lisu is next after the news with Daily Digest. Good morning to you.
Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's talk.